Hand, foot and mouth disease is one of the viral diseases that is only seen in children. It is caused by a virus and it can especially affect infants and younger children. Unfortunately, current medicine has no cure for this disease. Parents can only take precautions to reduce the risk of infection for their children. In case you are suspicious about this disease for your children, then this article is just for you. Here, you can learn more about the disease, including its symptoms, causes, and possible treatments. We believe that this article will contribute greatly to the parents and let them be more aware of possible risks. What is hand, foot and mouth disease? This disease is among our community for hundreds of years and we still could not develop any cure for it yet. This is mainly the hand, foot and mouth disease does not cause severe complications in children. It is a viral disease that is caused by a virus named Coxsackie-virus A16. Parents can only take precautions for their children to minimize infection risk. Almost 1/5 of the children in the world suffer from this disease. In case you will take enough precautions and be aware of the disease, you can protect your children from this viral disease. What are hand, foot and mouth disease causes? One of the main hand, foot and mouth disease causes in children is transmitting a virus named Coxsackie-virus A16. However, this is not the only virus that causes the disease. Although rare, other viruses from the same family can also cause the disease. It only transmits with the contact with someone who is already infected. In case your children will contact saliva, stool, blisters or nasal secretions of a person with the virus, he or she may get infected. What are hand, foot and mouth disease symptoms? The disease has some symptoms too. In general, these symptoms can be easily confused with flu symptoms. Therefore, parents should be aware of the disease and its symptoms. Some of the hand, foot and mouth disease symptoms include fever and sore throat. These two symptoms are very common in infected children. In addition to this, another common symptom is red blister-like lesions. These lesions usually appear inside the mouth. Moreover, sufferers can experience rashes on hand and foot as well. In case your children have such symptoms and they also lose their appetite, it will be better for you to visit a doctor. What are hand, foot and mouth disease treatments? As we mentioned before, there is no cure for the disease. However, you can prefer hand, foot and mouth disease treatments to alleviate the symptoms. In general, the child will recover within a week. Your doctor can prescribe different painkillers and recommend over-the-counter medications. Such medications can provide great relief for the children. However, you should not pick a random painkiller and give it to your children. Make sure that you consult a specialist in advance before giving any kind of medication to your children.